Hello, Vanakkam. It's so happy to see you all again, and I have a news for you. Babumet channel has 100 subscribers and even growing. Thank you so much for subscribing. I'm so happy and grateful. People who didn't subscribe, please subscribe to this channel because this channel is all about us. In today's video, we are going to see about corneal ulcer and keratitis. If you know, numerous number of questions has been asked from this topic. Watch it fully. If you want PDF, comment as PDF. Do not skip this video because you can easily secure 1 mark definitely from this video. So watch it fully. Let's start with the topic of corneal ulcer and keratitis. The first topic we are going to see about bacterial corneal ulcer. Please look at this image. You can see a single ulcer, right? A single ulcer with a well-defined, or it could have a distinct margin. Single ulcer with well-defined or a distinct margin. It has hypopyon. What do you mean by hypopyon? Pyon means pus. Hypopyon means nothing but pus in anterior chamber. It is sterile and mobile. Sterile and mobile means it is movable. The most common bacteria to cause this kind of eye infection are Staphylococcus. Let's see the investigation. It's corneal scraping, gram staining, blood agar. The treatment is we use antibiotic ointment or eye drops. In this case, we use ceftazidime 5% eye drop. The most important thing to see here is topical steroid are absolute contraindication. We should not use this topical steroid. It is contraindicated. Atropine eye drops can be also used. Symptoms are more pronounced. The next topic is fungal infections. Look at this diagram. Like we can see a satellite lesion. How to find out fungal infection? You can see like it is like satellite, right? It has a satellite lesion. How it is caused? It is caused by trauma with vegetable matters. Please look at the question very carefully. In question, you can see like a keyword of farmer while harvesting vegetable get poked into his eyes, or a patient came to the ward with a trauma vegetable matter. Like that you can see in your question paper. Satellite lesion are seen. Indistinct feathery margin. It is immobile and fixed non-sterile hypopyon. In bacteria, we seen sterile, and here it is a non-sterile hypopyon. And it is the dry leathery surface. For investigation, we can do corneal scraping, KOH mode, dextrose agar, and most common fungus to cause this kind of ulcer are most of the question paper has this kind of option like Aspergillus, fumigatus, or Fusarium can be also seen. And in this case also absolute contraindication are topical steroids. Remember that. And for treatment we can use fungal eye drops, antifungal eye drops. The drug of choice is natamycin 5%. Atropine eye drops can also used, and symptoms are less pronounced. This question has been appeared in exam. Symptoms are less pronounced. Now let's move to the next topic, which is viral keratitis. And I think you have seen these kind of images also. Like all of the questions and all of the topics has been mentioned here, appeared in every exam. So please listen it very carefully. If you want the PDF, you can comment as a PDF. Okay, let's go to next topic, viral keratitis. In viral keratitis, we are going to see hepatitis simplex virus keratitis. It is primary infection is conjunctivitis, and recurrent infection or keratitis. Clinical features are epithelial lesion. It is actually due to viral replication. Another clinical feature are dendritic ulcer. which is branching of terminal bud. We can see a dendritic ulcer here. See, these are the dendritic ulcer. Next, it has a decreased corneal sensation, painless ulcer, and the clinical feature, the patient might be complained with a foreign body sensation in his eyes or irritation in his or her eyes. And the stain and filter both have been appeared in the exam. This images appear in this exam, and dendritic ulcer is also appeared in this exam. The stain we have used in this case are fluorescent dye, and filter we use cobalt blue filter of slit lamp. And this question has been asked through 2-3 years ago, like Klebsiella pneumonia seen in keratitis, it's a one-liner question. And in this case also, steroids are contraindicated. What we have seen in bacterial ulcer, it is contraindicated. In viral ulcer also, it is contraindication. In this case also, it has been contraindicated. Treatment we use are acyclovir. 3% eye ointment 5 times per day into 10 to 14 days we will prescribe to patient. And the next question we are going to discuss about Acanthamoeba keratitis. It is caused due to extended contact lens wearing or misuse of lens. Misuse means if you wear lens like a long period, or if you have washed with the tap water. Organism is Pseudomonas. The keyword in the question will be also like a patient has a habit of using contact lenses, and he misuse with the usage of lenses, like that you can see. And culture media is non-nutrient agar with E. coli. In gram staining, you can see like this double-walled Acanthamoeba cyst. It is like a patho question. And in the patient image, you can see like a ring ulcer or lesion. It is most painful corneal ulcer. Patient will come with you with a very painful complaint. And treatment is polyhexa methylene biguanide. In short, we can tell PHMB 0.02%, and it is the drug of choice. So these are the topic I thought to discuss with you. Now let's see some of the PYQs. Let's revise it and let's see some of the PYQs. Steroids are contraindicated in what? Look at the option. Vernal keratoconjunctivitis, fungal corneal ulcer, atopic dermatitis, stromal keratitis. We have seen in 3 topics in this lecture, we seen steroid is contraindicated in bacterial, in viral, and in fungal also. In option, we can see fungal. Clearly, the answer would be fungal corneal ulcer. Okay. The next question. What is the characteristic feature of fungal ulcer? Recent NEET, it has been appeared, and it has been appeared in FMGE also. The previous question has been appeared in AIMS and FMGE as well. So let's see the next question. What is the characteristic feature of fungal ulcer? Look at the options. Reverse hypopyon, dendritic ulcer on a fluorescent dye, and ring abscess. And the final option is satellite lesion. In fungal ulcer, we have seen already, we can see satellite lesion. Let's go to the next question. It's kind of big question, but it's actually easy. A 30-year-old man present with history of injury in eye caused by leaf 5 days ago. See, leaf. Resulting in pain, photophobia, redness, and eye for 2 days. What would be the most likely pathology? They are asking for the pathology. Like leaf 5 days ago. History of injury. So it is also kind of vegetable matter. Trauma with vegetable matter. What you can hint from here, it is fungal corneal ulcer. It is fungal corneal ulcer. This question has been appeared in AIMS. And the final question, a non-sterile hypopyon is seen in options: pneumococcus infection, pseudomonas infection, fungal infection, and gonococcal infection. What's the answer? Non-sterile hypopyon is seen in fungal infection. So that's all for today. Hope you have been benefited from this lecture. If you like this, please subscribe, like, and share. See you in next video. Take care.